Hi, my name is Dominika Lisiecka. I lecture part-time here in the University of Limerick in the School of Allied Health on the postgraduate MSc Speech and Language Therapy program. Today I would like to talk to you about dysphagia, which means difficulty in swallowing. Dysphagia can really affect a person of any age for different reasons. A lot of the time dysphagia is associated with underlying neurological illness. Dysphagia has been recognized to lead to many medical as well as psychosocial consequences for people living with swallowing difficulties. In 2015, I was awarded a research training fellowship from Health Research Board, which allowed me to investigate the experiences of dysphagia in motor neuron disease. A lot of you would know that motor neuron disease is a progressive neurological illness for which there is no cure, and it has been recognized as a multi-system disease causing problems outside the motor system only. Which means that people with MND have to cope with a lot of additional problems and disabilities. I spent about 9 months talking to people with MND and their caregivers in the southwest of Ireland in relation to their experiences of dysphagia. I interviewed them more than once, and I also conducted observations of the mealtimes. And really what emerged from my study, I guess there was a lot of important themes which have implications for clinical practice. For example, dysphagia as part of multi-system illness such as MND should not be investigated or managed in isolation. We should always look at the bigger picture of the person living and coping with the disease. A lot of my participants spoke about non-oral feeding, which is one of the dysphagia management options in MND, which involves delivering nutrition and hydration directly to the stomach through a feeding tube. After that study, I became interested how people manage non-oral feeding in other populations outside motor neuron disease. Therefore, I was very happy to get the opportunity to supervise 3 master's final year projects on a speech and language therapy program. Orla, Fiona and Aisling, who are going to talk to you next about their research.
My name is Fiona. I am a second-year speech and language therapy student doing the Masters here in UL. Over 700,000 people in Ireland were living with neurodegenerative disease in 2010. This number is set to increase by 2-fold with the prevalence of dementia over the next 20 years. This research project will be following the meta-ethnography approach, which is an approach that allows for rich patient information to be incorporated through the synthesis of the findings. Neurodegenerative disease is a disease which causes a gradual decrease in abilities in certain areas such as swallowing, talking and walking. These areas in particular, swallowing is an area that we will be looking at. Non-oral feeding is placed in order to account for people's swallowing disorders. This with neurodegenerative disease will be necessary as the progression of the course of the disease will bring across swallowing difficulties, with bulbar patients noticing swallowing difficulties as one of their primary difficulties. The findings of my research are that patients found that time was a big overarching theme throughout their both decision-making and insertion of non-oral feeding, with the sense of loss, fear and the importance of quality of life being important themes that were shown throughout the research. The outcome of this research is to inform clinicians and future research to do more interest into the area of non-oral feeding and patients' experience, particularly with neurodegenerative disease.
My name is Orla McGrath and I'm a student on the Masters of Speech and Language course here in UL, and my final year project was about the experiences of enteral feeding in people with cancer. My interest in this project lay in that I wanted to know more about the experience of dysphagia, and especially in the population with non-oral feeding. 6 themes emerged from my studies, but many were hard to separate from the experiences of cancer in general. Themes like adapting to the tube taking time and an impact on socialization and also on sleep patterns emerged, and additionally this impacted on caregiver relationships. There was also a lack of information provision from primary care centres and a difference between the information provision in primary care and dietetics. Further research in this area could compare experiences of enteral feeding across conditions, as then we could focus on what experiences were from enteral feeding and what experiences were from the condition itself. We could also look at information provision in these populations and see what sources of information helped patients to cope with enteral feeding. This could help provide holistic and person-centred care across disciplines.
Hi, my name is Ashton Banas. I'm a second year speech language therapy student here at UL. The project that I studied was on the lived experience of family caregivers of the people receiving non-oral feeding. So my research project had a different focus than the other members of the project group. So my focus was on the family caregivers of people receiving non-oral feeding. These family caregivers can be spouses, parents, or daughters or sons of the people receiving non-oral feeding, and their role can have physical implications such as cleaning the tube safety, as well as administering the feeds, so making sure their loved one has nutrition and hydration. And it also has more psychosocial impacts, such as encouraging their loved one to participate socially, further organisation of family meal times, and overall maintaining a feeling of normality in their lives. One of the themes was that there was psychological distress for the family caregivers while they were caring for their loved one, and also that there was a perceived happiness in the person receiving non-oral feeding that helped them to cope with this. Interestingly, one of my results was that carers can help to manage their psychological distress by reconciling that their loved one is happier with the tube inserted and that there's been an improved happiness and overall quality of life, whether that be to their emotional well-being or their physical well-being. So some of the implications of my study were that support from health professionals needs to be more consistent and more continuous throughout the tube management, and also that family caregivers need to be educated more on the implications that being a caregiver for the loved one can have, and have more psychological support.
As you can see from the research that myself, Orla, Fiona and Aisling have conducted, dysphagia can have a lot of consequences for people living with this problem, and there is a lot more research we should be doing in that field. If you would like to work with us or get to know more about what we're doing in the department, you can contact me in the School of Allied Health in the University of Limerick.